Miss Barry. How are you doing today?
I'm okay.
Good. Well, my name's Peyton. I'm going to be your occupational therapist today. Do you know what occupational therapy is?
Mm-mm.
Okay, so occupational therapists, what we do is we look at things that are important to you, things that you may be having difficulty with, and we set goals together to work towards achieving those goals in the highest level of independence. So, for example, for you, you may have a goal of being able to go to the restroom independently, and that's something that we would work on in therapy. So there's a lot of collaboration involved, and the purpose of our session today is just to kind of see where you're at, how you're functioning, and what we need to work on to get you back to where you want to be. Does that sound good?
Mm-hmm.
Okay. I'm going to take a seat. There is some information that I need from you just to get this session started. So, before we get into the nitty gritty, are you experiencing any pain today?
Yeah.
On a scale of 0 to 10, so 0 being like no pain at all, and 10 being like the worst pain of your life, how would you rate your pain at the moment?
Like a 4.
4? Can you point to where the pain's at?
It's just everywhere.
You think it's more on that right side? Okay. Right side pain. Are you in pain like throughout the day or just so
Yeah.
all day?
Mm-hmm.
Does your pain get any worse or better, or is it consistently about a bit 4?
It's 4. I just get more tired.
Okay. Does it feel a specific way? Like, does it feel like a sharp pain or like a dull pain?
Mm-hmm. Kind of dull.
Okay. I have some questions about your home and who you live with. So, do you live alone? Do you have family members that you live with?
I have 2 kids.
2 kids? Okay. Do you have, so in your bathroom, do you have a tub or a shower?
I don't know.
No, that's okay. We can always revisit. I saw that you had a 3-story home. Are there any stairs to get into your home?
I don't remember.
Okay. What about inside the home? Do you know if there's stairs in there?
Mm-mm.
Okay. That's okay. Like I said, these are all things that we can revisit. Do you have any equipment at home that you use to get around? So like a wheelchair or a walker or a cane?
Not that I know of.
Okay. What about anything you use throughout the day to maybe retrieve things or make things easier? So like a shower chair or a reacher?
Not right now.
Okay. And then, do you drive?
No, I don't even remember.
That's okay. That's just the purpose of today, just to get a baseline. These are all things that we can totally revisit as we go. The last question that I have for you is, have you had any falls recently?
Not that I remember.
Okay.
No.
And do you know if, that was the second to last, this is the last question that I have before we get moving. So with things like dressing, using the restroom, showering, eating, is there anybody that helps you, or do you remember doing all of those things on your own before your stroke?
I think I did it by myself.
Okay. Sounds good. All right, let's get you up. Move this out of the way. Okay, so what we are going to do is get you sitting edge of bed. And how we're going to do that is we're going to roll you to the side. I'm going to bring your legs down and I'm going to help you sit up. I'll kind of walk you through it throughout the process. So we have some right-sided weakness, correct?
Mm-hmm.
So I'm just going to have you try and rest your arm here. I'm going to place one hand here and the other underneath here, and I'm going to roll you towards me, okay? 1, 2, 3. Very good. Okay. Very nice. Now I'm going to bring your legs down. Good. Okay. Now I'm going to reach below you. And I'm going to propel you upwards, okay? 1, 2, 3. Very good. Let's scoot you back just a little bit. How do you feel?
A little dizzy.
Dizzy? Okay, well, we'll stay sitting there before we get you up again. Okay. We're going to put this gait belt on you. Do you know what a gait belt is?
Mm-mm.
So the purpose of this gait belt is just to keep you safe. If you happen to lose your balance or anything, it's good because I can hold on to you. Okay. And it's supposed to be a little snug. Is it too tight?
Mm-mm.
All right. So now what we're going to do, I'm going to assess your scapula. It's this right back here, and we're going to do a few motions just to kind of loosen you up a bit before I assess how much you're able to move as far as range of motion is concerned. So, okay. And for the first motion, I'm going to get over here. So we're going to be doing elevation and depression. Elevation is like shrugging your shoulders, and depression is just bringing them back down. So I've got one hand here on the medial border, and I've got one hand here on the pec, and we're going to go up and down. We'll do it 3 times, okay? Ready? 1, 2, 3. How's that feel?
Good.
It feels really good.
Mm-hmm.
Okay, the next one that we're going to be doing is protraction. So I'm going to be grabbing onto your hand just like this, and then you can I'm going to tuck this into my elbow.
Mm-hmm.
So with the back of my hand, I'm just going to be pushing you forward. I'm not going to be pulling. 1, 2, 3. Feels good. How do you feel?
Mm-hmm. I feel good.
Okay. Last one we're going to be doing is upwards rotation. So it's just like bringing your arms upward.
Mm-hmm.
So I'm going to grab on your hand. I'm going to rotate you externally just a bit, and then I'm going to grab on right here, and we're going to go down, up, up, up. Very good. How's that feel?
Good.
Good. Okay. Now I want to assess your range of motion. So, can you bring your arms all the way up? Okay, the left looks within functional limits, and I would say the right is at about 50 degrees. Okay, you can bring it down. Very nice. Okay, what about to the side? Okay, it looks like left's within functional limits, and right, I'd say, is about 45 degrees. Bring that down. Very good. Can you try and bring them behind you?
Mm-hmm.
Okay, that left's within functional limits, and I would say right is at about 30. Okay, very nice. All right, and then can you switch your fingers? Open them. Touch each one with your thumb. Good. Hands up. Down. Very good. And then can you bring your elbows up? Okay. So for those last motions, I would say that they're both within functional limits. That's really good. I'm just getting this information kind of so when we're looking at goal setting, we need to get that. It's kind of good to have the left side to compare to the right, vice versa. Okay, so now I'm going to get some socks on you. We would consider this lower body dressing. Today we're working on upper body dressing, so that's why I'm putting them on for you. Okay. So we are going to transfer you into your wheelchair. While we're transferring, I would like you to use your left hand to hold the right against your chest, so just like that. We don't want you to sit on the right side or to have it snag on something, so just kind of for safety precautions, we're going to do that. What we're going to do is I'm going to rock you forward, and on the count of 3, we'll lift you up, stand for a second, turn, and sit down. And since you're not using your hands to reach back behind you, I just want you to make sure, and I'll remind you, that you can feel with the back of your legs the chair. Okay. So if we were doing this, I would make sure that her feet are flat on the floor, but just for the sake of this, we will say that they are. Okay. You ready?
Mm-hmm.
Okay, let's scoot you down. Okay, right there. All right, on the count of 3. 1, 2, 3. Okay, stand here. I'm gonna turn. All right, can you feel it?
Mm-hmm.
Slowly down. Very good. Okay, and then you can bring that down. Okay. Okay, so now what I'm going to do is assess the trunk and assess your sitting posture. So right now, your hips look like they're leaning a little bit forward to me, and we call that posterior pelvic tilt. So with your hips out like this, we would prefer them to be back here. So I'm going to grab onto your gait belt and scoot you back. Okay. Can you feel the back of the, okay.
Mm-hmm.
It looks like you're in a little bit more anterior pelvic tilt, which is where we want you. Now your trunk looks like you've got some right lateral flexion, so you just bring, very good. Does that feel good?
Mm-hmm.
All right, and then we're gonna look at knees. So it looks like your feet are in front of your knees, and we would like them behind. We'd also like your knees in 90 degrees. Does that feel all right?
Mm-hmm.
And then the neck and head is looking like it's flexed to the right. You just want it straight. How does that feel?
Good.
Good. Okay. I'm going to take your gait belt off. If you want to put your arms on the armrest, you can. And now we are going to do some dressing. Have you done dressing yet?
No, I haven't.
Oh, that's why I'm here. Okay. So what I'm going to be teaching you is a technique to dress, and it's going to be using a lot of that left side to help you get the right side in. Mm-hmm. So what you're going to be doing, okay, so you're going to place this in your lap. I'll demonstrate first, and then you can try and do it on your own. And you're going to place it facing you, scrunch it with your left hand. I know it might feel a little funny. Just try your best, and it'll take some time. And then once it's scrunched, set it in the middle of your lap. Grab your right hand with your left and fish it through. And then you're going to reach with your left hand from behind you, bringing it through, and threading your other arm through. Okay? All right. All right, you want to start with the left side? Very good. Now set it in your lap. Yep. Grab that arm. Thread it through. Make sure you get the fingers all the way out. Very good. Okay, now reach behind. Yep. And then get that left arm through. Good. How do you think that went?
Good. It's pretty easy.
I'm going to teach you how to take it off. Okay. So we're just going to do it backwards. You're going to take your left arm out first, and you can use the side of your chair to get it off. You can wiggle it with your shoulder, however you need to get it off on the left side. Good. Okay, now you're going to push it through from your left to the right, and grab it from your shoulder, bring it down, and then take it out with your left hand. So take your right arm out with your left. Good. Very nice. Nice job. We did some dressing. Okay, so I see, before I leave you, I see that some of your goals were to get back to work as an actress. Do you have any other goals that you'd like us to work on in therapy?
Really focusing on being a mom.
Okay.
And kids.
Yeah. So I'm going to take a look at all of the information that I gathered today from our session, and I'm going to write up some goals. We'll take a look at that, and then we'll start working on them. So
Okay.
today we did a transfer, we did some dressing, and I'm going to give you a pillow.
Okay.
We just want to make sure that we're doing proper positioning. So if you want to rest your right arm on here, does that feel a little bit better?
Mm-hmm.
Okay. So I am going to leave you here. If you don't have any other questions from me on my end, that's all I needed from you today. Thanks so much, Taylor and Hallie. I look forward to our next session.
Bye.